Join us on a captivating journey as we explore the charm, history, and vibrant culture of Wilkes County. Discover the hidden gems, inspiring stories, and remarkable people that make Wilkes a place worth knowing and celebrating. Join us now and experience the unique essence of life in Wilkes.
Arden Jolley, good to see you.
Good morning. Good to see you. Thank you for having me.
We all brushed our teeth knowing you were coming.
Thank you. I appreciate that. I was checking to see.
It was, just the general idea of being polite.
Thank you.
So
much appreciated.
You're a dentist?
No, actually, I'm not a dentist.
But you were?
No.
No?
Never have been a dentist.
You know a dentist?
I know one. I know a couple.
You know a couple of them.
Yes.
You've been in the dental field?
For many, many years.
That's right. Let's tell people what you do.
So I am the executive director at Wilkes Public Health Dental Clinic, which is a nonprofit dental clinic here in Wilkesboro.
So if everybody listening is like I initially was, because Heather Murphy was sitting where you're sitting a month ago, and we were talking about all the great programs that they have been involved with. And she began to share the story about dental vans and all these things that you have going on. And I'm like, well, that's incredible. So you mean that kids now don't have to worry if there's a place that's right.
That's right.
And it's open for everybody. I said, that's right. I said, we have to talk to the director because that sounds incredible.
Well, I appreciate that. Heather's amazing. I appreciate
So let's talk about why this organization come to be. I understand you've only been there a year or so.
Yep, just celebrated my 2-year anniversary.
Nice.
And
so why is the organization there?
So the history of the clinic is back in the mid-'90s, late 90s, a group of community people in Wilkes County were concerned that children in the county were not getting dental treatment, especially those with lower income or those on Medicaid insurance. And so this group worked for several years, 4 or 5 years, and finally was able to open the dental clinic. It was very small at first. Now we're up to 13 operatories. But at first I think they had one dentist and one assistant, and that was the staff. And so this group of people, which actually we still have people on our board that were part of that group originally, which is pretty cool. And so they worked really hard for 4 or 5 years, along with the help of Heather Murphy and the Health Foundation, the Partnership for Children, commissioners, everybody they could get to listen to them, to tell them about this mission. So at that point, there was not a lot of dentists in Wilkes County, and a lot of them were not either accepting new patients or not accepting Medicaid insurance. So this group of children were getting kind of left behind and not getting the care that they needed, and were having toothaches and abscesses or just need general cleanings, but they were having to leave the county to find a dentist or not be seen at all.
So it's not because people didn't care.
Exactly.
It was just the capacity, it sounds like.
Exactly, right.
Okay.
And, Wilkes County was very limited at that time. Thankfully, we've grown and there's more dentists in the community now. But at that point, there were not a lot. And I think looking back at the history, the average dentist should be able to see about 2,500 people. And at that point, when the dental clinic opened, each dentist would have to have seen almost 7,000 people to be able to see all the members of Wilkes County.
Wow, that just isn't practical,
right?
Is it?
No, not at all.
So there was a problem. People come together to address the problem.
Right.
And now we are sitting here having this conversation. You're 2 years in.
And the clinic's almost 25 years old.
So 25 years old. Tell us the difference that it's made.
Well, in just the 2 years that I've been there, personally, it's made a huge difference in my life. It's been amazing to be able to help the people in this community. I brag about Wilkes County all the time. I've never seen a group of people come together and help, not just dental, but any need that's needed in this community. Someone's here is going to help them. And so, but it has relieved some of the private dentists from where they're not feeling as stressed about seeing all these patients or seeing the Medicaid patients. We have now, like I said, grown into 13 operatories. We have
what does that mean?
So 13 treating rooms.
Okay.
And so we're able to see multiple people at once. Plus the mobile bus goes out to all the schools in the county. It's actually at Wilkes Senior Village today. It goes to Tyson. It goes to the nursing homes, group homes, anywhere that's needed. And what I have found in my first 2 years of being here in Wilkes County is transportation is a real issue for some. And even getting to the clinic, a lot of them have to take public transportation or hope for rides, things of that nature. But with the mobile clinic, being able to go out to those in the community and serve them where they are has been a true blessing for a lot of, especially the children in the Wilkes County schools.
So going to the schools, I get that, right? Because you go to a school and maybe you service 10 people in one day, right? But did I hear right? Am I hearing you say that if there's someone in the community, an individual, I mean, do you actually?
We can't take it to their home, but we can take it to like the medical centers or somewhere where they can maybe closer to where they are to get to them. We've recently, tomorrow and Thursday, we'll be at Tyson. A lot of those folks, it's hard for them to miss work or miss, even a half a day of work. And not get paid. So if we bring the bus to them, that's limited in the amount of time that they're away from work. And so it's a win-win for everyone.
Share some success stories. Tell us how this really makes a difference.
So I will give you an example of yesterday. We had a 22-year-old single mom of a toddler working as hard as she can, needs a root canal. And obviously she doesn't have the funds for that. Medicaid's not going to cover it. They're limited on what they cover. She's working hard, trying to do the best she can. She's raising this child on her own. Thanks to community members and donors, we have what we call our emergency fund. And so we can actually take funds for those that are in need if their insurance isn't going to cover it, or Medicaid, or if they just don't have insurance. Sometimes we can take funds out of that and help cover this treatment.
Bigger things.
Absolutely. Right. And so, for instance, Medicaid only pays for root canals up to your age 21. Well, she's 22 now, so she just missed the deadline. And she's in pain, having to miss work, which obviously she's got rent. She named all the things, rent, car payment, all the things that we all have too. Of course. So we were able to help her and take those funds out and get her in to get this taken care of.
What would have happened? What would have happened, or what could have happened to that individual who needed a root canal, infections going on?
Sure.
I mean, how bad could that have gotten?
So if the infection wasn't taken care of, it could have gotten really bad. Sometimes infection can get in the bloodstream, and we're talking very severe consequences. If we weren't able to do this root canal for her, and it is a front tooth, she works in the public, she would have to have that tooth removed. She did mention that she is the only family member that has all of her teeth. And so it's very important to us and my team to try to help her with this, because that was important to her. She wanted to save her teeth, and her parents, her grandparents, they had already lost their teeth at an early age, probably at her age when they lost their teeth, and it was very important to her. And what that does is it breaks a cycle too. She's going to see the importance of dental care, and that 2-year-old that she has, she's going to be able to bring that child into the clinic and get the care, and possibly break that whole cycle where you just assume my parents lost their teeth, so that's my future as well.
Right. Well, I mean, that sounds like such an amazing story, but I imagine that the need is easily multiplied by a lot of numbers, right?
Yes, and we're so appreciative of the Health Foundation, our churches, everyone that donates to us, but there is a great need, and those, obviously, that emergency fund can only stretch so far.
So that's if something bad's going on. What about just general care, just taking care of your cleanings and spotting those problems before they get big?
Right, and I've, reading through the history from Dina, the previous director, and we have several team members that've been there for 20 plus years. They always talk about kind of like that cycle being broken. If we can get these parents in, and they get their children in, and that they see how important, and they'll start coming in every 6 months for cleanings and checkups, and then we can hopefully eliminate a lot of these root canals and these bigger things that become a problem. And so if they come in regularly, get their cleanings, checkups, exam, which all of that Medicaid will cover, or private insurance, or again, we have a sliding fee schedule for those with no insurance, so we can kind of minimize the cost for each patient. But that's the key, and that's the important thing to make sure we're doing to hopefully eliminate big fillings, root canals, extractions, and those things in the future.
So it sounds like that a bit of the work that you're doing is some fundamental education,
It is.
right?
That's what it boils down to. I always say, the dental clinic is so much more than just teeth. That's our job, and we get up every day to come do, but it is a lot of education. We have a team member that's her primary position as she goes out in the community, and she goes to the Partnership for Children or Brock, wherever she needs to educate parents, and daycares and all those things to educate the parents on what they need to do to make sure that those children's teeth are healthy, and we can change lives that way.
In general, Arden, how do people respond? Is it something that, I don't know, if somebody says, hey, you've got to brush your teeth, twice a day and 6 times a day if you eat pie and cake 4 times a day. I mean, there are enemies, right?
Absolutely.
There are enemies to our enamel. And in general, how do people respond?
I think the majority of people are very responsive in a positive way and very appreciative of what we're trying to do. Not always the case, but I would say 98% of the time. We had an incident last year where Leanne, our community outreach team member, went to the Partnership for Children. And this mom was so proud of herself because instead of soda in the bottle, Coke or whatever, she was giving her juice in the bottle. But she wasn't aware, just from lack of education, that juice has probably just as much or more sugar than the Coke does. And so Leanne had a conversation with them, went wonderfully. The child came back the next week to the program and was bragging to the teacher about how she'd started putting water in her bottle or her sippy cup, and the child was so proud of herself for changing that habit. And but it was just the not knowing, but they took what we had to give them and they went with it, and I mean, it could prevented this child from having multiple cavities. That's
a hard one, isn't it? Because we look at the influence of our advertising, of just the idea. Okay, orange juice is great.
Right.
Well, I don't know. The way I understand it, the only way orange juice is great is we actually chew the orange up with the fiber and everything, get all of that together, right?
Yeah, right.
Then we've got at least some opportunity to actually feed our entire system with it without it being pure sugar. Oh, such a tough thing for Southern folk, though. We do love sugar.
We do. We love our Sundrop and all the things, but
there's a big cost, though, isn't there?
There is. Yeah. Yeah, wow. And sometimes it's hard to see that with all things in life.
But if you have your juice, and after breakfast you do a good brushing, right? Does that take care? That mitigates the problem.
Absolutely. But a child or infant or toddler sipping on a bottle or a sippy cup all day long, it's just recoding those sugar bugs, as we like to call them, on the teeth all day long. But you're exactly right. If you or I get up, have breakfast, drink our orange juice, brush, we're good to go. A good thing for adults or teenagers, if you drink through a straw instead of just sipping on it, or if you do need that Sundrop, drink it and then brush. Don't just, and a lot of us adults, we do that. We have our Sundrop or whatever it is at the desk all day, and we're just sipping on it all day, and that's when we run into problems.
Right.
But if you just drink it and brush, you're good.
Do you get hate mail from the advertisers, the people
Not
who are
yet, but
selling
it's probably yet to come. It's coming.
Arden, stop saying that about our stuff. And I don't know that it's an indictment on any particular thing. It's just the discipline that we have. Okay, we can have that if we do this.
Exactly.
Cause and effect, right?
And I think there's a lot of things in our life that we have to be mindful of those things.
I do not remember, this, in a few days I'm 60. So I do not remember growing up with that. I do remember growing up, but I don't remember there being a strong regimen other than brush your teeth in the morning and night.
Yeah.
But every time, we're eating pie and eating because
all these things.
None of our pie was store-bought.
Sure.
I mean, our family had just great cooks. I mean, it was really good stuff. I thought everybody had that environment, but they don't. No. So they have to eat whatever they eat. But I grew up with just great cooks in the family. And if I think back and I look at, even though, people would go to the dentist, there were over a period of time, there was always dental issues.
Right, yeah.
And I think it's that period time,
I'm
right?
sure. And, some people are prone to having more problems than others. Personally, my mom worked in dentistry. I grew up in the dentist office, so it was just normal for me. And how often did you brush your teeth? Probably still not well enough, but But I will say I didn't have any cavities till I was an adult. But
wait a minute. So what happened?
I don't know. I probably just got lazy. Got tired.
You got tired?
Old and tired.
Brushing your teeth. Like, how many times do I need to brush? Does that pie really work?
Well, I will tell you the key to and what we focus on at the clinic a lot is dental sealants. And so when my mom worked in dentistry, I had sealants as soon as my teeth erupted. We put dental sealants on there, which is just a protective coating on the biting surface of the sealant, or the tooth, excuse me. And so we focus on that a lot at the dental clinic too. As soon as these molars are starting to erupt, we want to put that protective coating on there. Those grooves in your molars, things can get down in there, and it's hard to get it out. So that lining just kind of covers that tooth up, protects it. And so I had dental sealants when I was young, and we focus a lot on that. So
you had some a defense mechanism put in.
And so we educate all of our parents on that, and our children, and either if they're in the fixed clinic at West Park or in the mobile clinic, we encourage dental sealants.
And as we get older, we just forget sometimes, right?
Sometimes, yeah.
We just make a little boo-boo.
Yeah.
All right.
We're tired. We just want to go to bed.
That's right. No, that's fair, right?
Yeah,
it's fair. I think that's so important when we talk about health issues, to talk about the big picture.
Right.
Because some people don't want to be, what's the expression, preached to or told what to do. Right. I think we all have a degree of that, right?
Absolutely.
So it's not like anybody's got a special corner on slightly off mental health issues.
Yes.
So we all have to deal with that.
We do.
I think, but we have to talk about it, right? We have to talk about it. Is that the key, talking about
absolutely.
it?
And just making sure, what we want everyone to know when they come to the dental clinic, they're going to be cared for and loved, not judged, no matter if this was they're 2 years old and they come to the dentist, or if they're 85 and they've never been to the dentist. We want.
Do you see that?
Absolutely. And so we just want everyone to feel welcomed, and we want to educate them in a kind, respectful way, and just do the best we can each and every day. And I am so blessed. We have the most amazing team at the dental clinic.
Tell me what the team does.
So I have 2 full-time dentists now, 1 part-time. I have 2 more dentists coming August 1st. I have 5 amazing hygienists and 9 dental assistants and a great administration team. Wow. And they all work together so beautifully. And each and every day it is work, but we come and try to make it as fun as we can, be there for our patients, help our patients. And we help them more, if I have a moment, I want to share a story. So we had a mom a few months ago. She came in for her child's dental appointment. Checking out, she started getting upset and crying, brought her to my office. And it wasn't anything about the dental appointment. She was trying to figure out how she was going to have enough gas to get the child to the next appointment. Oh, wow. Her power was getting ready to be turned off. All these things that we all sometimes take for granted when we wake up each morning. And do you know that my team, within 30 minutes, had that lady's gas tank full, power bill paid, formula and diapers from the Partnership for Children down the hall, a coupon to get clothes. Within 30 minutes, every immediate need that we could fill for that patient's mom was taken care of. So at least for that moment, I'm sure the next day more problems occurred, but at least for that moment she could breathe, know that she could get her child to the doctor and not have to worry. And that's what that team at West Park Dental Clinic does.
Wow.
It's truly amazing.
How did you sleep that night?
Amazing. Some days are hard and stressful, but we all go home and know that we did something good that day, and that makes a difference when you lay your head down at night.
Wow, that's great. How many people do you typically serve in a day?
So I was trying to think in a day. I will tell you that from July 1 to June 30, we saw over 17,000 appointments. So within our fiscal year, 22-23, we saw, 23 to 24, we saw over 17,000 appointments.
That seems like a lot.
It's a lot.
Right.
We're seeing now with Medicaid expansion that just occurred last fall, we're seeing an average of 150 new patients every month. And they're not necessarily just from Wilkes. A lot of the dental clinics in the surrounding areas, as many organizations are struggling with staffing, things of that nature.
Sure.
And so we're seeing people from other communities driving in because, knock on wood, we're very blessed and fully staffed, and I don't take that for granted.
No, that's great. What a testament to the work. Let's talk about this bus that goes out to the schools. That's interesting.
It's really cool. The bus is got two full, what we call dental operatories. So if you go to your dentist and you sit in that room with the chair, the bus has two of those on there. It also has the Panorex machine, the x-ray machine that goes around your head. So we can do basically anything in that bus that we can do at West Park. And so there's a few little things, but most everything we can do there. So during the school year, every day, Monday through Thursday, it goes out to one of the schools. They do the children's cleanings, fillings, extractions, whatever they may need. In the summer, we go more.
Now, how does that happen? Are those appointments, I assume, are already set before the bus gets there, right?
Right. And so we are very blessed. Dawn Jolley's our mobile director. She has a great working relationship with the schools and the school nurses. So they get all the paperwork stuff that needs to be done so the parents can fill that out. And so all the parents, no matter what insurance or income status the children have at the school, they're all welcome to come on the bus as long as they don't have a dental home already. And
what does that mean? So
if you're seeing another dentist in town, we don't want to interfere with that relationship. So if your child comes on or wants to be seen on the bus and they're already seen by another dentist, we want them to keep going to the dentist that they're going. But if they don't have a dentist or transportation's an issue for them to get to the dentist, the mobile bus is there for them.
Or if they're in terrible pain.
Or pain, yes.
Right.
And we never turn away a child if there's been a trauma or pain or injury. If the bus is somewhere, they can always, school nurses are really great about bringing them to the fixed clinic at West Park and getting taken care of. So, but yes, it goes out to all those schools all over the community or the county, and we take care of as many. I think they saw right at about 600 children this past school year.
Do we know about the long-term effects of someone who goes into that system of taking care of their teeth, right? And how does that affect them throughout the rest of their life? Does it keep them from getting other illnesses? Does it, help them excel in other ways? Do we know that data of how it really affects a person's life?
I don't know the specific numbers, but I will share that I do know that if a child gets into the dentist at a young age, it relieves a lot of anxiety. You've probably seen a lot of it. I mean, we see adults all day long that are, you can tell as soon as they walk through the dentist doors, they get nervous. And so that good experience, even on the mobile bus or in the clinic, and getting them established at a young age so that they don't have that fear. They know it's okay. Like for me, I was never frightened of the dentist. My husband, on the other hand, is horrified of the dentist. And so it just shows I grew up going to the dentist. Of course, I spent a lot of time there with my mom, but it makes a huge difference. But also not just caries or cavities or decay, but it makes a difference in your persona and how you present yourself as well. And so as we get older, and we may not think about that as a young child, but as we get older and we're going for a job interview and I'm sitting across from you, and if I feel confident about my smile, then I'm going to smile more. It's going to make it, obviously, the interview go much better, and you just feel more confident and happy with yourself. And so there's a lot of people that we're trying to help that don't have that confidence or hide their smile. They may not even realize they're hiding their smile. Sometimes they just magically put their hand over there, or when they smile, they don't show teeth, things like that.
Just as a defense.
Absolutely.
Right.
Yeah. So it doesn't, physically it makes a big difference too. There's information saying that if you have periodontal disease or gum disease, it can lead to heart issues and things like that. So there's all kinds of things physically too, that why it's important to take care of your teeth. But there's also a great, for confidence and just feeling good about yourself. We already have enough to worry about in the world.
That's right. That's right. Okay. So dental care is very important.
Yes.
And your organization is providing a solution.
Absolutely. We try every day.
Of which no one's going to be entirely turned away, are they?
No, absolutely not. No matter like I said, if you don't have ability to pay, we're going to find some funds and try to take care of that for you.
So is that an easy message to get out? You would think that it might be, but I can still imagine some complications.
I think it is. And of course, it depends on how many donations we have and how much we have in our fund, but we will always make a way. But it's amazing to me that the people that don't know about the dental clinic or don't realize that we're there, or a lot of people don't realize we're a nonprofit, but we are there to help in any way we can. So that's why I do appreciate you allowing me to be on today, because I want to get that word out there.
It's just a great story, and the idea that 17,000 individuals a year, I imagine some of those are carryover from the previous year, of course, but there would be a lot of new people in that mix. So
like I said, we're getting 150 new patients a month.
So those are some great numbers. So
what's very exciting.
What is the future? Let's project into the future. People could say, well, what else is there? I imagine there's more.
Yes, so we are growing every day. When I first started, we had no dentist and two hygienists.
Who did the work then?
Well, the dentist had just left, so we were on the search.
I see.
So in 2 years, we've grown from that to having 4 full-time dentists, 5 hygienists, and so we are, and our plan for the growth too was the Medicaid expansion. We wanted to be there for 6,000 additional adults got Medicaid in Wilkes County alone back in October. So we wanted to prepare and be there for those folks.
Have you started to see those people?
We have, yes. Okay. And so, but yes, we are kind of maxed out space-wise for a huge growth. But if my hope is to just continue doing what we're doing, keep everyone employed, all the patients coming in, and just help as much as we can. Now, one thing is Tyson is very new. This is our first time going out to Tyson.
What do you, when you go out, so you sit with the bus?
We take the bus out there, and so that's a growth incentive for us. And what we hope to see more in the future is to be able to go more to the people that need us, that can't get to us.
So is the idea there, because Tyson is so large, have so many people that work there, that it's convenient, or maybe something that they couldn't get otherwise because of whatever reasons, and you're there.
Right.
So were these people that were not served before?
I'm not certain. I believe so. And another issue with that is us going there, they have interpreters there. We have Spanish interpreters at our clinic, but we're kind of limited. And they have a lot of employees that speak different languages. And so if we go there, we can get either other coworkers or interpreters to help us communicate with those patients there too. So that's a big thing. But something to realize when we go to Tyson, if I miss an hour of work, it's not going to make that much difference to me in the long run. But for some people in our county, missing an hour of work is huge to them. And so I think that's another reason it was important to me to try to get, and Dawn and Cindy, my managers, to get that bus out to Tyson to help those people, that an hour of pay that could be life-changing for their budget for that month.
Right. Okay. All right. Wow. So many good things. So many good things going on.
Very exciting.
All around our teeth. So we need to make sure if we drink our juice, that we brush right away.
Right after.
Right?
Absolutely.
Right after. I mean, like
just get up and go straight to brush.
Go straight in there.
Just carry the brush with you from now on. Have it in your pocket.
Carry the brush. That's a good idea,
Absolutely.
right?
I have one in my pocketbook right now.
Wow.
You just never know when you might need a good brushing.
Maybe men should start wearing them in the lapel. Well, we don't. I got away from wearing a jacket, but then I was like, I like wearing my jacket. It's got pockets.
Absolutely, you can put all kinds of goodies in there.
I'm going to put.
You can slide you a little travel toothbrush right in that front pocket.
A little travel toothbrush, or you could be bold and express yourself with one of the big toothbrushes.
Absolutely. Spread the word.
What is the best toothbrush to use?
Well, we just don't care what type of toothbrush you use as long as you're using the correct end. So, doesn't matter.
That's funny. Why did that make me laugh so much? That's funny.
I used to work for orthodontists, so I would always ask them if they were using the right end of the toothbrush.
Right. Oh, because of what you were seeing.
What we were seeing on their teeth. Yeah.
You were giving them a little hard time there because they did such a poor job with the toothbrush.
We thought maybe they were brushing, they were just using the wrong side.
I love going for my cleanings. I think the cleanings are great.
Yeah.
They've got that new machine that they're using more. It's just water, that goes in.
Sprays it in there. We have those at the dental clinic.
Right.
So.
Do people like those?
It's funny. I think most do, but there are still a few that that prefer the old way. With the scraping.
Mm-hmm. I think my
hygienist will get me for saying scraping.
What's the proper
We're just
word?
removing the plaque and calculus.
Right, with a hard utensil.
Yes,
right.
With a scraper.
With a scraper, that's right. I think mine does a little of both, but she's doing
and
a lot
most
more.
do. Most use the little machine, and then they'll just touch up.
So twice a year is good enough?
Twice a year.
Okay, that's what
unless you have some serious gum disease or something like that. But
I had some things that I had to have dealt with, and I would imagine this is a fairly common problem. My dentist let me know this, that when you've had root canals younger in life, they don't last forever all the time.
Yeah.
So, and it's a big expense to have those done. So having those done, I was shocked at when I went to the dentist and one had broke, and it's like, well, it's gone.
Yeah.
So what are you going to do? Well, the root canal's been done.
Yeah.
So we need to put another one there. You have this whole series of things.
Lots
and
of options.
He said, I'll be back. I said, I don't want you to leave this room. When you leave this room, you come back with a piece of paper that
with a big bill on it.
It was like wow, and he laughed. He says, "I'll be back," and you're right. So that is a legitimate concern, right? Even for people who have taken care.
Absolutely, things can. I had an oral surgeon tell me one time that the teeth that God gave us, if they didn't last, don't expect anything that he put in there to last that long. I thought that's valid.
Oh, that's good.
Mm-hmm.
That's a good comeback.
So,
blame it on the Creator.
Right.
That's right. Oh my goodness.
We always got to find someone else to blame.
Yeah. Oh wow. All right.
But you're right. Even if you take great care of your teeth and you still have problems, you still do. It's not going to. Things have to be redone, and it's not going to last forever.
It's like painting the house,
exactly.
right? You don't get mad at the house because the paint's flaked off.
Or your car. I just had to put tires on my car, and that upset me.
How'd that make you feel?
It did not make me feel happy when I got that bill, but that's just part of it. And you got to get the oil change. You got to go do your maintenance. You got to do the things just with your teeth as well.
We have to be mindful of the fact and think of good things. Think of those tire people doing that job. You're buying the tires, and they're able to feed their families.
That's a very
and more
point.
importantly, they're able to go to the dentist.
Absolutely, amen.
because we need that tire, and the mechanic needs to put those rotors on.
So
there
it is a good cycle. We just keep everybody working and doing.
Yeah. Well, I like the idea of bringing a little levity to the conversation of dental work because it's so frightening
It can be.
To me.
Oh.
No, I fortunately I have great dentists. I have really good people.
We have some amazing dentists in this county. It's really, truly amazing.
It's a good thing.
Absolutely. This county is awesome.
All right, great. Okay, so we're in the summer now, so I'm guessing that we should probably see each other. Oh, I don't know. Your next, not a cleaning, but why don't we come in and talk after Halloween?
Okay.
All right?
Yeah.
Because there's going to be
When I have all the broken teeth from the
there's
Halloween
gonna be
candy.
stories. We need to do a PSA about being careful about these things,
that'd
right?
be great, absolutely.
All right. Well,
And I did want to just share real quick, on Thursday mornings, we do have what we call emergency extraction clinic.
Oh,
so
that's
if you
great.
do not have a dental home,
Right.
you do not have dental insurance, it's kind of first come, first serve,
Mm-hmm.
but you can call the clinic for more information. But for a small cash fee, you can come in and have a tooth extracted, exam and x-ray, and it's very beneficial for those. It helps keep people off the emergency room for pain and discomfort. And so I just wanted to share that with your
Okay, so Thursdays
audience. Thursday mornings.
are emergency extraction mornings.
Absolutely.
Right. Okay.
So
if someone is hurting on Monday, they just got to hold on
They
for a
can
few
hang
days.
on for just a few
Hang on.
days.
Come on down to West Park.
Absolutely,
And,
we'll get you fixed up. But
yeah.
it does help a lot of
Sure.
people in the county, and again, keeps a lot of people have to go to the emergency room for
I
those
love
types of
that.
things.
What a wonderful program. Your website is?
WilkesPublicDentalClinic.com.
Perfect. All right. Well, Aiden, it was great
Thank
talking to
you.
you.
It's nice talking to you.
Appreciate you coming in. My teeth feel better already.
Good. I'm so glad. Thank you so much. I appreciate
Thank you. Okay.
Thank you for spending time with us on Life in Wilkes. We value you as a viewer and appreciate when you share the show with your friends and family. Be sure to bookmark our channel and join us again on the next episode of Life in Wilkes.